Welcome back to Rip City Live from Blitz Lab in Southeast Portland as the Blazers get set to take on the Golden State Warriors for the second time this season. Time now for the injury report brought to us by RestorePDX. The Blazers with an injury update. Reports having Festus Ezeli not only out for tonight's game, but potentially out for the rest of the season as Al-Farouq Aminu deals with a back injury. His status doubtful going into the game tonight. And joining us now from RestorePDX, Dr. Desai. Thank you so much for being here tonight.
Thanks, Dan. Thanks for having me.
First of all, let's talk about the latest on Festus Ezeli. A couple months ago, he had an injection in his left knee. What's he been going through? What's that whole procedure all about?
So Ezeli had a injury to his meniscus or knee and probably some cartilage damage over the last few years. He had a surgery before. And obviously started hurting him, having swelling. We don't know exactly the details if he was having any mechanical symptoms, but they must have been relatively mild. And they decided, let's see if we can heal this with a bone marrow aspirate or stem cell-like procedure. And so how we do these, we've been doing them for probably about 6 or 7 years and have had really good success. But there is a 20% failure rate, and it really depends on what the tissue injury is, the patient, but and the time course that they can get back in. So sometimes it takes longer. It heals differently. But basically what it is using your own healing capacity. We're gathering stem cells from fat. So this is a liposuction technique or a bone marrow aspirate. And I think that's what he had, where a needle is placed into the hip, into the pelvic bone. Marrow cells are aspirated. So we hear that all the time, a bone marrow transplant. We're able to replenish our cells for cancer patients. And it's the same type of thing where you're able to extract those cells. They concentrate them in a centrifuge. And then they inject them depending on where the injury is. So they could inject using ultrasound or image guidance. They can inject into the meniscus or inject into the knee to help regrow the meniscus, repair the meniscus, regrow the cartilage. And the main thing is get the patient or the athlete out of pain and return to sport.
Gotcha.
It sounds like it was done about 2 months ago. And that's about the time frame. Usually I'm about 6 to 8 weeks, and I want to see significant progression. If that's not done, sometimes you can give a booster with the platelets and see if they can reignite the healing cascade. But after a while, you know, with these athletes, they have a very truncated time course. With some of our patients, we can wait, and even if we see 25, 30% benefit over time, we can allow them to heal. But that's not the case with these high-level athletes.
They don't have the luxury of that kind of time to wait.
Yeah. And so this is an example of where on the x-ray, the needle placed into the bone marrow, that's a CT scan of where it goes into the bone marrow cavity.
Gotcha.
And then it's injected. And here's a case where it did work. This is an MRI where the patellar tendon was injected. You can see a tear here. And this was over the course of a year. It took this athlete, high-level decathlete, 1 year to get back into play. And so then you have a debate. Do you do the surgery? Do you not? For this patient, the surgery was they couldn't do that. So
right. They had the luxury of time to wait a whole year to see the improvement.
Unfortunately, we don't know if that's the case with Festus.
Sure. Al-Farouq Aminu has been he had a calf injury earlier, but now he's dealing with a back bruise suffered a few games back. And we've seen video of this particular injury from that game, in the Memphis game, where he goes up high and really seems to fall on his side there. So it could be really, from a structural standpoint, any number of things, but they're listing it as a back bruise, a back contusion. So what is he likely dealing with right now, or what are some of the similar symptoms or situations you've seen in recent years?
So probably the most common, and these guys are really tough, are a contusion or a bone bruise. Where he landed is on kind of the junction of the lumbar spine and his pelvis, his hip, exactly where we showed where the needle was going for the bone marrow. And that junction is the SI joint. We'll talk about that a little bit. But, the common things that we see, and we don't know exactly what his symptoms are, but the main thing is, they're going to evaluate the patient where they're tender. Are the symptoms localized to the back? Are they radiating down the leg? Obviously, if they were having a sciatic-like symptom, you'd worry about something like a herniated disc, because falling on that could compress that area. But if you look at this model that's focused on the lumbar spine, the main structures that we worry about are the bones or the vertebrae. In between the blue structures are the discs. The yellow are the spinal nerves. There's facet joints that we have at each level, so little tiny joints that can get strained and irritated. And then all the ligaments and soft tissues. And then we can't forget where he fell is the SI joint, where the lumbar spine actually meets the pelvis. So there's dense ligaments and strong tissues there, as well as the joint. And then we oftentimes will do an MRI, and in this case you can see the bright here. There's a lot of inflammation showing that there was an injury in that area that not only injured the joint but the bones and the ligaments. So depending on that time course, it can be a few weeks for a deep bone bruise or injury, and then depending on the others, it could be a much more extensive course. So your physical examination, finding out what the patient's suffering through, imaging to diagnose exactly, and then if it's not something that's surgical or needs an injection, those types of things, then it's the tincture of time, conservative management, chiropractic care, acupuncture, oxygen chambers, whatever you can do to get that athlete to heal.
Not only healing, but also pain management to some degree. If it's just a deep bone bruise or a deep bruise in general, it's just a matter of not only healing it completely, but how much, as long as it still could be there, but dealing with the pain as you make your way back to the basketball court.
Exactly. So we're in favor of all these other adjunctive therapies. I'm not a big fan of medications, especially narcotics, and even with anti-inflammatory. Short courses when somebody has a bruise can be okay, but if you get them on long courses, we've seen with like Alonzo Mourning and some of these other athletes, when they're on the NSAIDs and those things, it's not a good situation. So we try to also think of the athlete and their health, short-term and long-term.
For sure. Dr. Arul Desai, thank you so much from RestorePDX. You can check him out at RestorePDX. Still ahead on Rip City Live, we put the Blazers through